Members, return to the chamber and take your seats. Mr. Clerk. Oh, how about, Mr. Clerk, would you ring the bell and let everybody know we're ready? All members return to the floor, please. All members. All members. I hope you all had a filling lunch and didn't eat too much. I'll be watching you. I'll call your name if I see you dozing off. If somebody will do the same for me, Sam. We'll move on to the rules calendar again. Mr. Clerk, will you read the caption to HB 873? 873.
House Bill 873 by Representative Gunther of the 8th and others to be entitled an act to amend Title 15 of the Official Code of Georgia annotated relating to courts so as to create a juvenile treatment court divisions. This bill having been referred to the Committee on Juvenile Justice, that committee recommends that this bill do pass by committee substitute.
Chairman Stan Gunther is recognized to present the bill. Chairman Gunther. Suspend just for a minute, Mr. Chairman. See if your mic's turned on down there. On the bottom, Mr. Chairman.
Oh, that one. Okay.
It's that
Thank you.
technology stuff, man. I know as a judge you had somebody doing that for you.
Yeah, I have a hard time with that now. So. Okay, House Bill 873 is, this bill brings juvenile treatment courts under the Council of Accountability Court Judges. CACJ is what I'm going to call it from here on. This legislation is needed to fully bring this court type under CACJ and provide the same support and oversight to the juvenile drug and mental health courts that exist for the other courts under CACJ umbrella. Juvenile drug and mental health courts are currently supported with state funds via a competitive grant application managed by the CACJ and the CJCC. However, there is currently nothing in law that gives CACJ the ability to provide guidance to these courts or to mandate best practices. CACJ is seeking enabling legislation to officially authorize the agency to provide standards and best practices, to collect data, to provide training, etc. The number of these courts has doubled over the past decade, and the juvenile judges leading these courts are asking for the guidance and expertise that state standards, certifications, and peer review offer. There are also new national best practices that CACJ and the judges are seeking to bring to these courts. Every other accountability court type that is funded through CACJ has enabling legislation that provides the specific guidance. The agency is seeking to bring those same standards to the juvenile drug and mental health courts. There is no budget request at this time, but they anticipate asking for a new position in the FY26 to perform the certification and the peer reviews. And if you haven't been to a mental health court or drug court graduation, you ought to go and see one. You'll see what that's all about. It gives these people hope. It brings them back into our society. And I'll stand for any questions.
You do have a question. Representative Becky Evans to your left is recognized for a question. Representative Evans.
Does the gentleman yield?
I yield.
Yes. Isn't it true that I serve on the DeKalb Juvenile Justice Council, and I definitely support this measure.
Thank you very much. I appreciate that.
Thank you.
Gentleman, yield for another.
I do.
To your left, right in front of you, Representative Al Williams is recognized for a question.
Thank you, Mr. Speaker. Will the gentleman yield?
I yield.
Is it not true that Liberty County had the second drug court in southeast Georgia, and it has been very, very successful?
That is correct. Yes, sir.
Thank you, sir.
Gentleman, yield for one more.
Yes, sir.
Representative Kennard to your left has a question.
Mr.
Representative-
Gentleman, yield.
I yield.
Isn't it true that I recently attended 2 accountability court graduations, and it is a powerful way for someone to redeem their life and get a second chance?
Thank you for that. Yes, sir.
Mr. Chairman, we appreciate how you've, in your career, have worked for the people of this state, and the knowledge you have of how these courts work certainly is very important to us, and thank you for the members for supporting this legislation. You have no further questions.
Thank you. I yield the well.
The gentleman has yielded the well. Is there any objection to the previous question being ordered? Chair hears none. The previous question is ordered. Is there any objection to adopting the committee substitute? The chair hears none. The committee substitute is adopted. Is there any objection to agreeing to the report of the committee, which was favorable to the passage of the bill? Chair hears none. The report of the committee is agreed to. Shall this bill now pass? All in favor of the passage of the bill will vote yes. All those opposed will vote no. And Mr. Clerk, will you unlock the machine? Representative Williams, could you? The other Williams is coming to the rescue. You voted. Have all members voted? All members have voted. If so, the clerk will lock the machine. On the passage of House Bill 873, the yeas are 152, the nays are 0. This bill, having received the requisite constitutional majority, is therefore passed. Mr. Clerk, will you read the caption to House Bill 909?
House Bill 909 by Representative Hagan of the 156th and others to be entitled an act to amend Chapter 3 of Title 35 of the Official Code of Georgia Annotated relating to the Georgia Bureau of Investigation so as to provide for the restriction and seal of First Offender Act sentences until such status is revoked. This bill having been referred to the Committee on Judiciary and Non-Civil, that committee recommends that this bill do pass by committee substitute.
Representative Lisa Hagan is recognized to present the bill. Representative Hagan.
Thank you, Mr. Speaker. Representative Williams, I'm going to need you to wake up for this one. Colleagues, I have House Bill 909 for you for your consideration today. This bill would modernize Georgia's First Offender Act. The First Offender Act was first enacted to prevent an isolated mistake from leading to a lifetime of barriers to employment, housing, or anything else that a person needs to do to be successful that requires a background check. This bill does not change who is eligible to receive a first offender sentence. But what it does do is it changes the timing of the sealing of records. Currently, records are restricted at sentencing, but they aren't sealed until the successful completion of a first offender sentence. This bill would both restrict and seal those records at sentencing. And the reason why I believe this is necessary at this point is that everything is online. So our court documents can be found online if a private company, background check company, does a background check when someone goes to apply for a job, for housing, and other things. So to restore the true intent of Georgia's First Offender Act, we need to be sealing these records at sentencing instead of at the completion of their sentence. GCIC data that we pulled shows that only about 2% of those who receive a first offender sentence do not successfully complete their sentence. So this has potential to help a lot of people enter the workforce, stay there, find good housing for themselves and for their families. I would note that the Chambers of Commerce support this bill because of the positive impact it could have on workforce development. You've got a couple of letters on your desk from the chambers of support. Mr. Speaker, that is the bill, and unless I have any questions, I'd be happy to yield.
You have a question if you'll yield.
I will.
You have a couple of questions. To your left, Chairman Parsons has a question.
Thank you, Speaker. Lady Yield.
I do.
Wasn't it true? First of all, I completely support what you're doing here. I think it's a great thing. I wanted to ask, you said that the sealing would happen at the time of sentencing.
Yes.
So I assume, or I don't assume, but does that mean that the ones that are already serving probation or already been sentenced, that would not apply to them? Is that correct?
It applies to them in that if they've already completed successfully their sentence, or if they're currently serving that sentence when they successfully complete, they could go to the judge and request the sealing, and that would happen automatically.
Okay, thank you very much. I appreciate your work.
Thank you.
Lady Yield for a couple more.
Yes, sir.
Representative Panich to your left in the back.
Does the
Recognized for a question. I'm sorry. Yes, ma'am.
Thank you. Does the gentle lady yield?
I do.
Is it not true that as a criminal defense lawyer, first offender treatment is an invaluable tool to help people get back on their feet and support their family?
I believe that it is.
Thank you.
Yeah, thank you.
Representative Gladney is recognized for a question to your left.
Thank you, Mr. Speaker. This is Gentlelady Yield.
I do.
Is it not true that once your legislation passes and this is no longer a part of an individual's record, would this allow them to now serve in the United States Armed Forces?
Well, that is a good question, and I must admit I do not know the definite answer to that. I would assume that someone in here does. It does. It does. I have been assured that it does.
All right. Thank you
Someone in
very
the back.
much for this legislation.
Thank you
ma'am.
for your question.
Yes,
That-
ma'am.
That was great teamwork there, Representative. Would you yield for one more question?
Sure, I will.
Representative Kennard to your left has a question.
Is the lady yield?
I do.
Isn't it true that Georgia was formed originally as a penal colony and prisoners would come here for a second chance? And doesn't HB 909 recertify us as that second chance state? And don't we need to do more legislation like this?
Yes.
Thank you.
Asked and answered. Good question, good answer. You have no further questions.
Thank you, Mr. Speaker. I yield the will.
Is there an objection to the previous question being ordered? Chair hears none. The previous question is ordered. Is there an objection to adopting the committee substitute? Chair hears none. The committee substitute is adopted. Is there an objection to agreeing to the report of the committee which was favorable to the passage of the bill? Chair hears none. The report of the committee is agreed to. Shall this bill now pass? All in favor of the passage of the bill will vote yes. All those opposed will vote no, and the clerk will unlock the machine. Have all members voted? All members voted? If so, the clerk will lock the machine. On the passage of House Bill 909, the yeas are 155, the nays are 0. The bill, having received the requisite constitutional majority, is therefore passed. We had a couple of bills that we carried over yesterday. Mr. Clerk, would you read the caption to House Bill 1037, 1037?
House Bill 1037 by Representative Daniels of the 117th and others to be titled an act to amend Chapter 2A of Title 31 of the Official Code of Georgia annotated relating to the Department of Public Health so as to create the Georgia Commission on Maternal and Infant Health. This bill having referred to the Committee on Public Health, that committee recommends that this bill do pass by committee substitute.
Representative Daniel is recognized to present the bill.
Thank you, Mr. Speaker and colleagues. Today, I rise to present a very important bill for the people of Georgia, the women of Georgia, and the babies of Georgia. I'm excited to do this today. It is House Bill 1037. Let me get this organized. All right, so first I want to explain what the bill does. It creates a commission on maternal and infant health in the state. That's the overview. There are 14 people on this commission. The governor is to appoint 6 of them. It will be an obstetrician, either a pediatrician or a neonatologist, a nurse midwife, either a family practice or general practice physician, and a representative of a perinatal facility. And then the lieutenant governor has 3 members to appoint, and the Speaker of the House has 3 members to appoint. The DPH commissioner or his or her designee will also sit on the commission, and a person from the Research Alliance will also be there as well. This commission shall meet at least 4 times per year, and it is to solicit the views of perinatal facilities, providers, women in the state, and determine the effectiveness of perinatal care in Georgia. It also will make available to the public the records of all of our meetings and what is discussed, and make statewide policy recommendations based on the findings. There is a sunset clause on this from 2 years from now. So a detailed written report will be provided by July 1st for the people of Georgia. Well, I guess it's actually by June 30th, and it repeals on July 1st if it's no longer needed. Now, one of the things I want to say that I received questions in committee about this bill was, what's the difference between this and the Maternal Mortality Review Committee that we already have? So the Maternal Mortality Review Committee examines women that have already died. What this commission aims to do is to examine the things that lead to those deaths. And I believe that that's very important. I also believe that we should be looking at infants because we have a high infant mortality rate. And so all of this to say, this commission is going to allow us as policymakers to have a more holistic view of the issues in this arena. And it's also going to give us the ability to say to the women of Georgia that we hear you, we see you, and we care, and we're going to do what we can to help you. And although we have put in place things for the last 10, 12 years, thanks to Chairwoman Cooper and the leadership of this House, we still have a ways to go. So this commission is not the beginning of the work that is going to be done on this issue, but it's actually an expansion of the work that has already been done. And so it's a very exciting day. And I believe I have some colleagues that are going to speak in favor of it as well. But I ask for your favorable consideration, and we'll take any questions if you have them.
The lady has no questions. Wait, hold up. Will you take a question, lady in the well?
I do.
Will you take a question? Representative Buckner has a question to your left.
Thank you, Mr. Speaker. And does the lady yield?
I do.
In your definition of perinatal, what do you anticipate that time frame being? Because that's not a definite time people usually have to define it. Do you know if it's gonna be 6 months?
Yeah, so it is the time, the definition of perinatal is the immediate time before birth and then up to a year after birth, to my
Okay.
understanding.
Thank you.
Thank you.
Lady, yield for one more,
Sure.
because there are some speakers in favor, but will you
Yes.
yield for one more? Representative Bennett to your left is recognized for a question.
Thank you, Mr. Speaker. Would the gentlelady yield?
Yes, ma'am.
Is it not true that I support mental health services for perinatal moms?
Yes, ma'am.
Thank you.
You have no further questions.
No further questions. Thank you.
The lady has yielded the well. Representative Park Cannon, are you ready? Representative Cannon is recognized to speak to the bill. Representative Cannon.
Thank you, Mr. Speaker. I'm here to speak in support of this bill for two reasons. One, given our statistics, collaboration is key right now. As many of you found out today, I am a Spanish-speaking doula. I am certified, and I am credentialed in the state of Georgia. And I can tell you that we need a safety net for birthing people. To anyone with concern about the term birthing people, I will point you to ACOG, the American College of Obstetricians and Gynecologists. They are the leading medical organization dedicated to the health of all individuals in need of gyno and obstetric care, to which the board of directors 1 year ago adopted the following policy. ACOG acknowledges the effect language has on individuals and populations. To be inclusive of women and all patients in need of OBGYN care, ACOG will move beyond the exclusive use of gendered language and definitions. This change includes integrating language that reflects the broad spectrum of gender identities into ACOG guidance, resources, and communications in order to improve the quality of care for all patients, including those who identify as women and those who do not. This is also predicated on the amicus brief, Doe versus Abbott. Since we talked about Texas today, maybe you will go back and look at that amicus brief by the American Academy of Pediatrics and additional national and state medical and mental health organizations in support of the plaintiff's application for temporary injunction for a client in Texas who was denied gender-affirming care. But back to Georgia. Within the United States, Georgia has one of the highest maternal mortality rates. Within the world, the United States has the highest maternal mortality rate. That means Georgia is trailing the country and the world. I've been tracking this for the past 7.5 years of being here, and the past 3 years have been alarming, which is why the Women's Caucus put together a letter to request the postpartum funding that many of you may remember was really a group effort. As of 2020, Black women are 3 times more likely to die from pregnancy-related conditions. In 2021, the death rate in Georgia increased by 1.2 deaths per 1,000 inhabitants, which is a percentage point of 8.58. In 2022, the home birth rate in Georgia increased between 29% and 49%. That is the highest home birth rate increase in the United States. In 2023, the hospital closure prevalence in Georgia became the 3rd highest in the country. So today I've listed here, it's a little difficult to see, but some providers that we should include beyond just OBGYNs. Those would be program administrators, newborn care specialists, infant nursery managers, doulas, OBGYN nurses, lactation consultants, pelvic floor specialists, labor nurses, maternity nurses, NICU nurses, NICU nurse assistants, midwives of all kinds, cardiology consultants, support counselors, prenatal nutrition counselors, logistics technicians, case managers, phlebotomists, patient care technicians, surgical technicians, nurse managers, audiologists, nurse practitioners. The list goes on and on. As you can see, this commission has an opportunity to include a wide variety of birth workers. Now to my second point of supporting this bill. This actually empowers state actors to do what they're already able to do, but I guess by providing them more directive, they might do it a little bit quicker. The first piece is to get private and federal funds to end maternal mortality now. We can already do that, but it spells it out in this piece of legislation. 2, it'll give due consideration to recommendations of medical and scientific organizations in the field of perinatal care. Now, this could mean that those people could sponsor a bill that creates a fund for surviving families of maternal mortality. They could sponsor a bill that reimburses birth centers at the same rate as hospitals. They could sponsor a bill that provides coverage of doula services to expectant and postpartum people. They could sponsor a bill that enhances access to culturally competent quality care. They could sponsor a bill that provides for community health workers and use telehealth. You could have them reimbursed through Medicaid. You could sponsor a bill that provides trained birth workers on the ground and incentivize building a training to become a midwife. They could even sponsor a bill that incorporates father support or partner support in education. The list goes on. And I will just finish by saying that I really believe the time is now to act on some of these policy recommendations that they have already given us that I just spoke to, because this report won't be ready until 2026, the end of that year. Whereas we already know in the 2018 to 2020 report, we saw that there were over a total of 270 deaths, and 89% of them were preventable. We know that time is ticking, so if we give 2.5 more years, I'm really wondering how many more Georgians won't make it. So in the meantime, we can act on the study committee that was passed in 2019. Right now, there were 19 recommendations as we've looked through and looked at the items that have been acted on. It's been 10 of them. There's still 9 left, and since we have 2.5 years for this commission, I'm hopeful to see these following 3 included. 1 is to encourage continued research on racial disparity and social determinants of health that impact people who are pregnant in Georgia. There are 2 others, but for this time, I would just like to thank you for possibly supporting this legislation and to continue to think about birthing people as a term that is not gendered and that it actually helps, which is why ACOG has adopted it. Thank you. I yield the well.
The lady has yielded the well. Representative Kennard, speak in favor of the bill.
Thank you, Mr. Speaker. I wanted to take a moment and give you a Big Poppy update, a Big Poppy status report. As of yesterday, my grandson Nathaniel turned 13 months old. You can see a picture of him right there. And he's doing all the things. He's walking, running, climbing, smiling, laughing. He's got about 6 teeth now, so he's eating. He's jabbering his head off. I have no idea what he's saying, but he clearly has a lot on his mind. Just this past week, Alex and Nathaniel spent about 9 glorious days with us, and it was just, we had ourselves a time. I knew grandparenting was going to be great, but it exceeds expectations. He fills my heart with such joy and love, joy unspeakable. When Alex was carrying Nathaniel, she had a relatively healthy pregnancy, but she did have a couple of complications. One was gestational hypertension, where her blood pressure was spiking to the point that she had to be hospitalized 3 or 4 times during her term. And towards the end of the term, it became a greater concern, and they actually induced her and brought Nathaniel into this world a few weeks prematurely. Now, what kind of de-escalated the situation for us and gave us more peace of mind, in addition to our faith, was the fact that they had great healthcare insurance, which afforded them the best of prenatal and maternal care. So she had all the facilities, all the hospitals, the doctors, the nurses, the OBGYNs. She had everything, all the infrastructure was in place to take care of any medical concerns. As you know, too many times wealth and income determines a lot of our health outcomes. That's the way it is in Georgia. A lot of the pregnancy and maternal negatives that we're seeing amongst our mothers in Georgia is coming from low-income mothers, low-income families. I'm hoping that this commission will look at the factors that address that, and we bring more equity to our health outcomes so that every mom can have a wonderful and healthy pregnancy. Thank you. Oh, and for further Poppy updates, please visit my Facebook page so that you can follow the Poppy Nathaniel journey. Thank you, Mr. Speaker. I yield the will.
Gentleman has yielded the will there, Big Poppy. Representative Big Poppy. Representative Glaze. Representative Lydia Glaze is recognized to speak in favor of the bill.
Thank you so much, Mr. Speaker. I stand today in support of House Bill 1037. Thank you for my colleagues who brought this bill. As I stand, I'm excited about the opportunity that we will create in this commission. This commission, we hope that will bring back information that will help us with legislation and appropriations. In the meantime, we will continue and need to continue to focus on this scourge and to make sure that mothers in the state of Georgia have our support in bringing their children into the world. I speak from my personal life experience as having 2 pregnancies that were high risk. I'm a mother of 2 sets of twins. That is correct. And one, I was on bed rest the entire time from 6 weeks out, trying to save my babies. The second one, we made it to 30 weeks. And I want to tell you they're 31, and another set turned 35 last week. And I say that to thank those who are my advocates, Dr. L.B. Hasty, who was OB chair at South Fulton Hospital. I'm sorry to say that that hospital doesn't exist anymore. My 4 children are here in this state. They came back to this state after college and grad school to make their lives here. I'm honored as their mom that they would come back. I have a grandson that was born at 21 weeks. There is no medical plan for a 21-week-old child. So we waited 7 days praying every day. God, if he is to live, please let him live. He is 8 years old, 25 surgeries later, kindergarten twice over. And this summer we taught him to read. 2 grandmothers. I say all that to say that this bill means a lot to me, but it means a lot to all of us. And all of us can take what we know to be pride in the work that we will do for mothers. We hope that there's not another 279 in the next 4 years. What I will ask you is that this commission that we're putting together, that we will not leave mothers out. Mothers who have survived high-risk pregnancies. Our voices need to be heard on the commission because there's no better person to tell you what they've went through and what they've gone through and how they survived other than the survivor. So as I stand, having had those high-risk pregnancies, and now have the highest joy of my 4 children back here in Georgia and my grandson, 8 years old, kindergarten twice, but now knows how to read. Thank you so much for bringing this bill. I yield the well.
Lady has yielded the well. Representative Jasmine Clark. is recognized to speak to the bill.
Thank you, Mr. Speaker. Today I rise in support of House Bill 1037. First, I want to acknowledge the necessary, important, and tremendous work of the Georgia Department of Public Health and the Maternal Mortality Review Committee. This report gave an eye-opening account of the causes and contributing factors to maternal mortality, as well as making recommendations that could address Georgia's horrible maternal mortality rate and the disproportionate rate of pregnancy-related death among Black women. This report also outlined the 6 top causes of maternal death: hemorrhage, mental health conditions, embolism, preeclampsia and eclampsia, cardiomyopathy, and cardiovascular and coronary conditions. For each of these causes, the report gave recommendations on how to address the contributing factors to each. For example, the report emphasized how management of chronic conditions prior to a person becoming pregnant and in between pregnancies is important for improving health outcomes in pregnancy and reducing maternal mortality. Altogether, this report laid on an important foundation for reducing maternal mortality rates in Georgia. Accordingly, the bill that we are debating today and that I am supporting today seems to seek to continue this work through recommendation of public policy that can improve maternal and infant mortality rates in our state. I do believe that it is incumbent upon us here in this august body to listen to the medical community who deals with these types of issues on a daily basis and can make scientifically sound policy recommendations based on medical consensus. I look forward to a commission that will recommend policy that extends beyond pregnancy, both before and after pregnancy. And while I will be voting today with hope that this commission will add to and not just duplicate the tremendous work done by DPH with their MMRC and their report, I will also express a little concern that I normally have with any commission that has 100% partisan appointments. As of today, this commission will be appointed by 100% Republican men, which gives me some pause, but my vote today is that this will not be a partisan attempt at undermining efforts to addressing a true crisis in our state. Additionally, I hope that the appointees on this commission include not only healthcare administrators and healthcare providers, but also healthcare recipients. I think it's important to have the voices of the Georgians that will be directly impacted by the policies we propose and possibly implemented at that table. I also think that since mental health is one of the top causes for maternal mortality, but that there is no requirement that there be a perinatal mental health specialist on this commission, that we should also ensure that that voice is at the table. I also think it's important that we have the voices of Black women who are disproportionately affected by maternal mortality at the table. We have an opportunity to do something great here, and I'm so excited to support it. And if we're going to do it, let's do it the right way. Lives in Georgia are depending on it. And with that, Mr. Speaker, I yield the well.
Lady has yielded the well. Representative Lupton is recognized to speak to the bill. Representative Karen Lupton.
Thank you, Mr. Speaker. Thank you, colleagues. I rise today in support of HB 1037. Many of my colleagues have spoken before me very eloquently of how we know what's happening in our state. We don't have to tell many people the people who are most in danger do not need to be told that there is an issue about this in the state. They know it because they live it. There are a lot of ways that we can attack this problem. When we attack the social determinants of health, such as poverty, such as housing instability, such as food instability, such as access to mental health, when we expand our scope and we take in the fight, we also affect those maternal mortality numbers. Because so much of what happens during a woman's pregnancy happens before she's even conceived. If we make women healthier in this state, our maternal mortality numbers will get better. Now, it's been noted that we've had other studies, other working groups on this. This is great. It's been said that we can expand on the work that we have done so far. There are things that we can do to expand the scope of practice for midwives, to help get lower cost medical technicians to some of our healthcare deserts. I'm really alarmed at how often the phrase healthcare deserts comes up when we speak about women's health. We can fully expand Medicaid. I know that's not a popular idea, but let me tell you what kind of difference that would make for the people who are impoverished in our state. Now, if we come up here and we persist, if we repeat ourselves, if we insist on bringing attention to this issue, it is in large part because we see ourselves in these numbers. We see women that we love in these numbers. We see our daughters, we see our nieces, we see our granddaughters, we see our aunts. You may come to understand our urgency when you consider the fact that 4 out of 5 maternal deaths are completely avoidable. I'm going to repeat that. 4 out of 5 maternal deaths in this state are completely avoidable. We call for haste as we move to save as many lives as possible. Thank you, Mr. Speaker. I yield the well.
The lady has yielded the well. We have one more speaker, that's Representative Kimberly New. Representative New.
Thank you, Speaker. Members, I wrote it down because this is very personal. Last year, we got here, very excited to be here. First week here, found out that out of 4 grandchildren, all boys, that I was going to have my first granddaughter. I was thrilled. Her birthday was going to be tax day, April 15th, which is actually my grandfather's birthday. The week of January 23rd, things changed. My daughter wasn't feeling well. She went to the doctor. They checked her out. She was okay. They sent her on home. 2 days later, she was swollen everywhere. She went to the ER. They checked her out. Sent her home. Said, you're okay. Check in with your OBGYN. She did. Thank God she did. She was able to see her OBGYN on Friday, who sent her straight to a specialist. They stuck her in the hospital immediately. She had preeclampsia no one that week had seen. It had not shown up. It's fast moving. It's killing our kids. It's killing our daughters. Friday night, my daughter and my granddaughter went into stress. There was an emergency surgery, saved both of their lives. My granddaughter was born 2 pounds, 7 ounces. She fit in the hand of my son. She was in the NICU for 83 days, struggling, fighting for her life. My daughter had to advocate for herself and for her baby. This shouldn't have had to happen, but thank God that she did. If we had had Georgia Maternal and Infant Health Commission at that time, they could have helped as soon as she had started getting these symptoms. I'm proud to say that my granddaughter just celebrated her first birthday. She weighs almost 20 pounds, and she's perfectly perfect. We need this commission to advocate for our daughters and our unborn babies. This is life-changing prevention. I thank you so much for bringing this bipartisan bill. What a great way to work together for our children and our children's children. I yield the well.
Would the lady answer one question for me?
Yes, sir.
What's that beautiful granddaughter's name?
Her name's Riley Marie, and that is her on the right when she was born. She was this big, and now she's a little fatty. She's right at 20 pounds, and she loves to eat everything. And I'm so thankful for it.
She's beautiful. What a miracle. What a miracle.
Thank you, sir.
That lady
I
has
yield the
yielded the
well.
well. Is there an objection to the previous question being ordered? The chair hears none. The previous question is ordered. Is there an objection to adopting the committee substitute? Chair hears none. The committee substitute is adopted. Is there any objection to agreeing to the report of the committee, which was favorable to the passage of the bill? Chair hears none. The report of the committee is agreed to. Shall this bill now pass? All in favor of the bill will vote yes. All those opposed will vote no. And Mr. Clerk, will you unlock the machine? Have all members voted? For what purpose is Representative Gladney rise?
Thank you, sir. Is it not true, parliamentary
Is this a
inquiry, sir?
parliamentary
Yes, sir.
inquiry? Yes, ma'am.
Is it not true that out of 159 counties, Richmond County ranks 103rd in quality of life, indicators of poor health, poor physical health, and low birth rate above all the counties in this state? And bringing this bill forth does, in fact, give us hope and something to look forward to in our county, sir. Thank you so much for bringing this bill.
That is, I'm sure if the lady's looked at the numbers and she knows that to be true.
Thank you, sir.
Thank you. Representative Jordan Ridley, for what purpose do you rise?
Parliamentarian inquiry.
State your inquiry.
Is it not true a birthing person is in fact a woman as you need a vagina to give birth?
Well, I'm sure the gentleman feels that to be true. Have all members voted? If so, the clerk will lock the machine. On the passage of House Bill 1037, the yeas are 160, the nays are 0. The bill, having received the requisite constitutional majority, is therefore passed. Mr. Clerk, will you read the caption to House Bill 1083?
House Bill 1083 by Representative Williamson of the 112th and others to be entitled an act to amend Article 7 of Chapter 3 entitled 37 of the Official Code of Georgia annotated relating to adult residential mental health services licensing so as to extend grace periods applicable to the Department of Community Health. This bill I refer to the Committee on Public Health. That committee recommends that this bill do pass by committee substitute.
Chairman Bruce Williamson is recognized to present the bill.
Thank you, Mr. Speaker. In 2022, this body passed a new licensure category for adult residential mental health care centers. We needed this licensure class for two reasons. Number one, up until this point, until we passed this legislation, they were being classified as personal care homes, which obviously made it necessary for the Department of Community Health to grant waivers to be able to administer drugs. The second problem and bigger financial problem was that a lot of insurance companies would not reimburse services because of the licensure category being under personal care homes. So we passed the legislation
to create this new licensure class. And as a result of that, it was good intentions that came out of it. There's been a lot of interest expressed in being able to, other mental health care providers coming into Georgia provide similar service, drug and alcohol treatment services and such as that. The department has asked for an extension on the implementation for the rules and regulations for 12 months, up to 18 months. And all interested parties are in agreement on this. Much needed extension because it was supposed to be in effect January the 1st. They have granted some temporary provisional waivers for those folks that are already offering these mental health care services. So just ask for the body's favorable consideration of extending the regulatory and provisional license dates. I'd be happy to answer any questions or yield the well.
You have no questions.
Thank you, Mr. Speaker.
Gentleman has yielded the well. Is there any objection to the previous question being ordered? The chair hears none. The previous question is ordered. Is there any objection to adopting the committee substitute? Chair hears none. The committee substitute is adopted. Is there an objection to agreeing to the report of the committee, which was favorable to the passage of the bill? Chair hears none. The report of the committee is agreed to. Shall this bill now pass? All in favor of the passage of the bill will vote yes. All those opposed will vote no, and the clerk will unlock the machine. Have all members voted? All members voted. If so, the clerk will lock the machine on the passage of House Bill 1083. The yeas are 161, the nays are 0. The bill, having received the requisite constitutional majority, is therefore passed. Mr. Clerk, will you read the caption to House Resolution 804, House Resolution 804.
House Resolution 804 by Representative Martin of the 49th and others, a resolution proposing an amendment to the Constitution so as to change the date by which temporary loans for counties, municipalities, and other political subdivisions of this state are payable in full. This bill having referred to the Committee on Judiciary, that committee recommends that this bill do pass.
Chairman Martin is recognized to present the resolution.
Thank you, Mr. Speaker. Let me explain first what this bill doesn't do, or what this resolution doesn't do. This constitutional resolution does not amend the Constitution to allow local subdivisions to get more money or to in any way change the way they can offer these tax anticipation notes. What this proposition does is allow that note to be paid for over a 12-month period. Right now, it's arbitrarily due on December 31st. And in cases where tax bills go out late in the year, in October, November, and are not due until after December 31st, this doesn't do our school systems, in some cases our cities and counties, but primarily school systems that get the most of their revenue from ad valorem tax. It doesn't do them any good, because they can't borrow money to pay these notes, right? This is not a rotating or revolving credit line, and this resolution does not make it one. This simply says that this has to be paid back over a 12-month period. I call your attention to line 14 and line 16 and 17. There's a couple of changes on the back to reference that language, but what this does is simply allow our school systems the flexibility to borrow money for tax anticipation loans already allowed for in the Constitution and pay that back over a one-year period, not the arbitrary date of December 31st. Mr. Speaker, it's that simple. I would answer any questions. It's an important measure and is a constitutional resolution and requires 120 votes. So I'd answer any questions in order to align people, and hopefully we can move this forward.
The gentleman has a few questions. Does
Yes,
he
sir.
yield?
Yes, sir.
Representative Bazemore is recognized for a question right to your left.
Thank you, Mr. Speaker.
Thank you, Mr. Chair, for bringing this bill. And you know that we have had a situation in Fulton County where we had a problem with our bills going out on time, and then the money was not there to pay our staff and everyone else. I greatly appreciate you bringing this bill.
I thank the lady for her question, and again, Fulton County has brought this bill to us and has experienced this really at no fault of their own, because of the unique set of circumstances. So this is good for all of the school systems around the state, but I thank the lady for the question.
Thank you.
Representative Holland, to your right, has a question.
Thank you, Mr. Speaker. Does the gentleman yield?
Yes.
Is it not true that many of us in Metro Atlanta received communications from our school districts today encouraging us to vote in favor of this bill? And I wanted to ask in case my colleagues had not seen their emails yet.
Yes, and it's also true. I love it when a plan comes together and the school boards back legislation they ask for it. Thank you. I thank the lady for the question.
I think y'all planned that. You have no further questions.
I yield the well and ask for the House favorable consideration on House Resolution 804.
Chairman Martin has yielded the well. Is there any objection to the previous question being ordered? Chair hears none. The previous question is ordered. Is there any objection to agreeing to the report of the committee, which was favorable to the adoption of the resolution? Chair hears none. The report of the committee is agreed to. Shall this resolution now be adopted? All in favor of the adoption of the resolution will vote yes. All those opposed will vote no. And the clerk will unlock the machine. Have all members voted? All members voted. If so, the clerk will lock the machine. On the adoption of the resolution, the yeas are 161, the nays are 0. The resolution, having received a requisite constitutional majority, is therefore adopted.
Clerk will read the caption to House Bill 1162. House Bill 1162.
House Bill 1162 by Representative Knight of the 134th to be entitled an act to amend Title 48 of the official code of Georgia annotated relating to revenue and taxation so as to revise the terms Internal Revenue Code and Internal Revenue Code of 1986 and thereby incorporate certain provisions of the federal law into Georgia law. This bill having referred to the Committee on Ways and Means, that committee recommends that this bill do pass.
Chair recognizes Chairman Knight to present the bill.
Thank you, Madam Speaker. About almost 20 years of doing this bill, the IRC update, this is probably, it is the shortest one that I've ever done. If you'll notice that the only changes here are moving the tax year into the year beginning on or after January 1, 23, for that fiscal year. The reason is Congress has not passed any tax laws. So nothing has changed. We're just codifying for this past tax year what is at federal law. I will let you know that we have a vehicle out there, HB 1163. Should Congress pass something before we get out of here or in a timely manner, such that if there are tax changes that should be passed, we have a vehicle that we'll try to get those on and through, but I wouldn't hold my breath as far as Congress making any new tax law in that time. So again, shortest tax Internal Revenue Code revision, update that we've got. With that, I'll stand for any questions.
There are no questions? Oh,
They-
you do have one, if you'd care
All
to. The chair recognizes Representative Clark for a question. Oh, she waves. No questions.
All right. I'll ask you for favorable consideration of House Bill 1162.
Is there any objection to the previous question being ordered? The chair hears none. The previous question is ordered. Is there any objection to agreeing to the report of the committee, which was favorable to the passage of the bill? The chair hears none. The report of the committee was agreed to. Shall this bill now pass? All in favor of the passage of the bill will vote yes. All those opposed will vote no, and the clerk will unlock the machine. Have all members voted? Have all members voted? If so, the clerk will lock the machine. On the passage of the bill, the yeas were 161, the nays were 0. The bill, having received the requisite constitutional majority, is therefore passed. Clerk will read the caption to House Bill 925. House Bill 925.
House Bill 925 by Representative Saints to the 180th and others to be titled an act to amend Article 1 of Chapter 3, Title 38 of the Official Code of Georgia annotated, relating to general provisions relative to emergency management, so as to prohibit any governmental entity from discriminating against enclosing a place of worship during an emergency. This bill having referred to the Committee on Public Safety and Homeland Security, that committee recommends that this bill do pass.
The chair recognizes Representative Sains to present the bill.
Thank you, Madam Speaker. Colleagues, I bring before you House Bill 925, known as the Protecting Religious Assembly in States of Emergency Act. This bill simply ensures that places of worship are not unfairly targeted or discriminated against during states of emergency like we've seen across our nation, unfortunately. I'm proud to stand before you in saying Governor Kemp, in cognizant with how he treated our faith institutions, ensuring that they had the ability to decide for themselves if they were going and how they were going to practice their religious beliefs, has also heavily supported this piece of legislation for future circumstances. This bill explicitly prohibits any government entity from issuing orders or directives that would close churches or other places of worship in a manner that is more restrictive than the limitations imposed on other entities. In essence, the bill simply makes them gives them a most favored status in terms of operational restrictions during emergencies. Madam Speaker, I know that the hour is late after lunch, and if there's no questions, I will yield.
We have one question.
I yield.
The chair recognizes Representative Park for a question.
Thank you, Madam Speaker. Does the gentleman yield?
I do.
Is it not true that if this bill were the law of the land back in 2020, that it would have undermined the ability of Governor Kemp to protect the health and safety of Georgians?
I think Governor Kemp has done a tremendous job not only protecting the health and safety of Georgians, but the economic vitality of our communities, and I agree with him on this bill that it's a good measure to have in place for future
Does the gentleman further
generations.
yield?
One more question.
Is it not true that in 2020, Governor Kemp opened up our outdoor public parks, in which if this bill again were the law of the land, that would have also required indoor facilities such as places of worship to also be open, despite the fact that they were super spreader events at that time?
Well, based on previous statements, I'm surprised how in favor you are on the governor's handling of this, but I commend you for it. I think he did a great job in opening our public parks when others were telling him to shut them down.
So you're not going to answer the question.
Thank you.
Thank you.
I yield the well.
Gentleman has yielded the well. Is there any objection to the previous question being ordered? The chair hears none. The previous question is ordered. Is there any objection to agreeing to the report of the committee, which was favorable to the passage of the bill? The chair hears none. The report of the committee is agreed to. Shall this bill now pass? All in favor of the passage of the bill will vote yes. All those opposed will vote no, and the clerk will unlock the machine. Have all members voted? For what purpose does Representative Roman rise?
Thank you. Parliamentary inquiry.
State your inquiry.
Is it not true that a big part of my opposition is because there is a concern that if, God forbid, there's some kind of attack or something, this limits a leader's ability to respond to that and help constituents figure out what to do in that kind of an emergency?
I'm sure the lady believes her position. For what purpose does Representative Clark rise?
Parliamentary inquiry.
State your inquiry.
Is it not true that the reason why I'm a no on this bill is because I do not believe that we should be taking tools away from our leadership when there are times of an emergency where they have to be able to act and make good decisions?
The lady has clearly stated her position. For what purpose does Representative Hagan rise?
Parliamentary inquiry.
State your inquiry.
Isn't it true that if people can go to Walmart to buy groceries, there's no logical reason why they shouldn't be able to go to their church to worship if their leaders at that church deem it safe for them?
I'm sure the lady believes of what she says. And last parliamentary inquiry, for what purpose does Representative Cox rise?
Parliamentary inquiry.
State your inquiry.
Is it not true that as people of faith, that the greatest place we could be in a moment of sickness is in the church so that we can have prayer and healing for one another?
I'm sure the gentleman believes of which he speaks. Have all members voted? If so, the clerk will lock the machine on the passage of the bill. The yeas were 112, the nays were 50. The bill, having received the requisite constitutional majority, is therefore passed. Clerk will read the caption to House Bill 814. House Bill 814.
House Bill 814 by Representative Camp of the 135th to be entitled an act to amend Article 2 of Chapter 7 of Title 48 of the Official Code of Georgia annotated relating to the imposition rate computation exemptions and credits relative to income taxes so as to revise the definition of the term qualified investment property. This bill having referred to the Committee on Ways and Means, that committee recommends that this bill do pass by committee substitute.
The chair recognizes Chairman Camp to present the bill.
Thank you, Madam Speaker. I bring to you today House Bill 814. And if you live in the metro area, you might be wondering why this bill is necessary. But there are many areas outside of the metro areas that have really horrible internet. And I believe that this bill has the opportunity to do the greatest rural economic development of anything possible we could do today. This bill says that the BEAD grant, the Broadband Equity Access and Deployment Program, as well as the American Rescue Acts, when they're used to put fiber in the ground, will not be beholden to income tax. And this potentially could be 2,500 to 3,500 more roads in the state, potentially another 18,000 to 25,000 people who have the opportunity to have fiber internet with these grants. These areas will dry up and die without funding, and this is an opportunity for the state to let the money go where it was intended to go, to the people of the state. I yield for any questions.
The chair recognizes Representative Cannon for a question.
Thank you, Madam Speaker. Do you yield?
I do.
Just have a question on the credential doula registry. Right now, we have a tracker that shows how many families we try to reach out to get them prenatal or postpartum services. And one of the highest numbers out of the 6,000 is 3,000 people who have been unable to reach. How do you think this bill addresses those rural families that we're trying to reach for perinatal outcomes?
Well, thank you for that question, Representative Cannon. The truth of the matter is, when individuals don't have access to the internet, they don't have access to telehealth and also being able to contact medical providers, as well as education, applying for jobs, working from home. There's a whole litany of things. And I appreciate you bringing that point because I believe that it will be helpful in the future once we get the fiber in the ground and all Georgians have access to the internet, that hopefully that number will whittle down substantially to zero.
You have another question. The chair recognizes Minority Whip Park for a question.
Thank you, Madam Speaker. Does the gentlelady yield?
I do.
Is it not true that I greatly appreciate your bill and that that this piece of legislation was made possible by President Biden, who signed into law both the Bipartisan Infrastructure Act along with the American Rescue Plan?
Well, I thank you also for your question, but much like Georgia's legislative body and governor, nothing is possible without both bodies of the Congress. So certainly there was a part with the signing, but I thank all the members from Georgia who did vote in favor of making this legislation possible.
Does the gentlelady yield for one more question?
I do.
Is it not true that every single congressional Republican voted no to the American Rescue Plan Act of 2021? And I appreciate every member of this body who will be voting yes to this bill today.
Well, I don't have those numbers in front of me, but I appreciate you bringing that to my attention.
Thank you so much.
And there are no more questions.
All right, thank you. I yield the well. Thank you.
The lady has yielded the well. Is there any objection to the previous question being ordered? The chair hears none. The previous question is ordered. Is there any objection to adopting the committee substitute? The chair hears none. The committee substitute is adopted. Is there any objection to agreeing to the report of the committee, which was favorable to the passage of the bill? The chair hears none. The report of the committee is agreed to. Shall this bill now pass? All in favor of the passage of the bill will vote yes. All those opposed will vote no, and the clerk will unlock the machine. Have all members voted? Have all members voted? If so, the clerk will lock the machine. On the passage of the bill, the yeas were 162, the nays were 1. The bill, having received the requisite constitutional majority, is therefore passed. Clerk will read the caption to House Bill 991. House Bill 991.
House Bill 991 by Representative Blackman and the 146th and others to be entitled an act to amend Article 6C of Chapter 8 of Title 31 of the Official Code of Georgia annotated relating to hospital Medicaid financing program so as to extend the sunset provision. This bill having been referred to the Committee on Appropriations, that committee recommends that this bill do pass.
Chair recognizes Chairman Blackman to present the bill.
Thank you, Madam Speaker. Fellow members, bring before you House Bill 991 on behalf of the Department of Community Health, which is the sunset extension on the hospital provider fee. It's an agreed upon method of the way we draw down medical funding for Georgia. Be happy to try to answer any questions if there are any, Madam Speaker.
You have a question. The chair recognizes Representative Au for a question.
Thank you. Does the gentleman yield?
Yes, yes I do.
3 very short questions. The first one is, what is Georgia's current FMAP percentage? That's the Federal Medical Assistance percentage.
Are you asking how much we draw down?
Yes.
It's about 900 million, I believe. The overall hole in the budget would be roughly 2 billion.
So about 66% of the cost is what the federal.
It is.
Okay. Second question is, what would the federal contribution be if we availed ourselves of the federal funding available through the Affordable Care Act to fully expand Medicaid?
I'm not sure I know the answer to that question. Not my area of expertise, but you may.
It would be more than 90%. So the last question is, given 66% versus 90%, would it not be a more fiscally responsible and durable solution that we don't have to keep renewing this to fully expand Medicaid?
I'm sure you probably believe that to be true.
Thank you.
Thank you.
There are no more questions.
Thank you, Madam Speaker. I ask for your favorable consideration and yield the well.
Gentleman has yielded the well. Is there any objection to the previous question being ordered? The chair hears none. The previous question is ordered. Is there any objection to agreeing to the report of the committee, which was favorable to the passage of the bill? The chair hears none. The report of the committee is agreed to. Shall this bill now pass? All in favor of the passage of the bill will vote yes. All those opposed will vote no, and the clerk will unlock the machine. Have all members voted? If so, the clerk will lock the machine. On the passage of the bill, the yeas were 157, the nays were 1. The bill, having received the requisite constitutional majority, is therefore passed. House Bill 1010 will be postponed to the next legislative day. For what purpose does Representative Hughley rise?
To make a motion.
State your motion.
Madam Speaker, I move that House Bill 148 be moved from the Education Committee to the Committee on Higher Education, and both chairmen have agreed.
Clerk will read the caption.
House Bill 148 by Representative Hughley of the 141st to be entitled an act to amend Part 9 of Article 6, Chapter 2, Title 20, the official code of Georgia annotated relating to grants for educational programs.
On the lady's motion that House Bill 148 be withdrawn from the Education Committee and recommitted to the Higher Education Committee, is there objection? Hearing none, it is so ordered. For what purpose does Chairman Ballinger rise?
To make a motion.
State your motion.
Madam Speaker, I move that House Bill 924 be moved from the Insurance Committee to the Health Committee. Both chairs are in agreement.
Clerk will read the caption.
House Bill 924 by Representative Ballinger of the 23rd and others to be entitled an act to amend Chapter 24, Title 33 of the official code of Georgia annotated relating to insurance generally so as to prohibit insurers from discriminating against certain health care facilities.
On the lady's motion that House Bill 924 be withdrawn from the Insurance Committee and recommitted to the Health Committee, is there objection? Hearing none, it is so ordered. We're moving on to afternoon orders. The chair recognizes Representative Jaspers for an afternoon order. We're going to limit orders to a minute and a half each.
Thank you, Madam Speaker. Real quickly, we're off tomorrow for Valentine's Day. 4-H Day is tomorrow. There'll be 700 kids from all across Georgia coming to see you. If you're here, I hope you take time to see them at lunch tomorrow at the depot. There'll be gifts in your offices and your desks from all these great kids, and I hope you take time to visit with them. Thank you, Madam.
Chair recognizes Representative Roman for an afternoon order.
Thank you, Madam Speaker. I'm way too short. Colleagues, today I have the immense honor of sharing with you a little history for Black History Month, specifically about one of the first Muslims in the United States was a black Muslim named Bilali Muhammad. Bilali was brought to Sapelo Island in Georgia as a slave. While some Muslims in the United States did not feel safe expressing their faith, Bilali found himself in a place where he could more freely express his religious convictions. He even built what some consider the first mosque in the continent. He also wrote a 13-page manuscript considered to be the first book of Islamic jurisprudence in America. It covers everyday essentials for a Muslim, from prayer times to ablution rites. That manuscript continues to be an important and key document in Muslim history in the U.S. Muhammad's legacy continues today. His descendants make up the community of Hog Hammock. In fact, some historians believe that Hog Hammock is one of the last intact island-based Gullah Geechee communities in America. Unfortunately, the community risks total displacement from the island. Many of the families have been forced to move off the island because of lack of infrastructure and schools. Local policies are also risking property taxes beyond what the few remaining families can afford. We need to do all that we can to protect this precious history and community. Thank you, Madam Speaker. I yield the will.
Chair recognizes Representative Williams for an afternoon order.
Thank you, Madam Speaker. I rise to share a little-known Black history fact concerning a Georgian. In 1952, Ralph Waldo Quarterman organized one of the first NAACP chapters in Georgia. It was organized in Liberty County. He died, before he died, he went to Ghana because he owned a sawmill in Midway. He went to Ghana to train the Ghanaians how to operate sawmills. Died in 1964 at the young age of 46. We have the Liberty County Commission has unanimously allowed us to erect a statue to Ralph Quarterman in front of the courthouse in Hinesville. And it's the commission to do the sculpture went to a sculpture on St. Simon's Island. Dave Pullen. When this statue is erected, it will be the first statue of an African American on a courthouse ground in the entire South. This is today's little-known Black history fact.
Chair recognizes Representative Hutchinson for an afternoon order.
Thank you, Mrs. Speaker. Happy Mardi Gras. I would like to say happy Mardi Gras. We have king cake in the ante room for me and Representative Vanelowitz. So we're very homesick on this day, so hopefully you can celebrate with us. But today I come to you with another set of siblings who are up for adoption. I'm sorry I've been off of my game, but I think I have the same illness that someone else had with laryngitis. I'm just now getting over it. So I wanted to tell you about this group of boys, Connor, Chase, and Elijah. They are handsome brothers who enjoy a close-knit relationship and value being together. They're responsible and organized. They're also described as funny, empathetic, and caring. They do well in school, and science is their collective favorite subject. Sibling groups like this are extremely difficult to adopt, especially ones with this range in ages. So I appreciate it if you talk to anyone who was interested in adoption, and thank you so much for all the work that you've done in the last 4 years. And I yield the will.
Thank you, Representative. The chair recognizes Representatives Holly, Bell, and Bruce for an afternoon order. Members will please rise.
Thank you, colleagues. Thank you, Madam Speaker. We rise today to show our debt of appreciation to one of our fallen alums, Donald Cheatham, who passed away on the 1st, was a native of Chicago, an alum of the DeSalle Institute, and an alum of Morehouse College. This proud Georgian resident served his time working in the community, very active with the Morehouse College Atlanta Alumni Association. He was a tax accountant, and even though cancer may have claimed him, thankfully Morehouse College named him. And just at this time, we'd like to, if you all would just join in just a brief moment of silence so that we can honor his life. Thank you.
Thank you, members.
Sorry.
The chair recognizes Representative Douglas for an afternoon order.
Thank you, Madam Chair. You don't have to really stand for this, but you can stand for this. I wasn't going to give up and give a morning order after the Super Bowl, but I got a call last night from one of my students that I coached in Henry County, and we were well represented in the Super Bowl. He plays for Kansas City. His name is Trey Dean III, number 42 for Kansas City. And also, he was another student of mine who I had was Will Anderson Jr., who was the Defensive Rookie of the Year. Now, both of these guys came from the same high school that I coached at when my kids went to school, and that is Dutchtown High School in Henry County. So there is great things coming out of Georgia. So we thank you. I yield the well.
Chair recognizes Representative Townsend for an afternoon order.
Thank you, Madam Speaker. I rise in support of Georgia educators. Everyone in this room, in this chamber, owes educators a debt of gratitude. None of us would be here without them. A teacher that took us under their wing. A teacher that brought us their subject, that brought the subject to life in the classroom. Whether it's science, reading, social studies. An educator encourages us to pursue our dreams through higher education. Whether it's 4 years, 2 years, post-secondary is important, y'all. In case of some of us, a teacher inspired us to become educators ourselves. I thank Mr. Brown from Lithonia High School. I'm proud of the work we've done under this Gold Dome to support our teachers. Pay raises, classroom funding, providing for school security so our teachers can focus on educating Georgia's young men and women. I'm proud to be an educator, and of all educators in Georgia, they should make us all proud. Madam Speaker, I yield the well.
Chair recognizes Chairman Saines for an afternoon order. He waives. The chair recognizes Leader Beverly for an afternoon order.
Thank you, Madam Speaker. Tomorrow, February 14th, 1944, my mother was born. She'll be 80 years old. Her favorite number is 4, mine is 8. And when you have a boy like me, you're always concerned about 1 Corinthians 13. Verse 4 says, love is patient, love is kind. Verse 8 says, love never fails. My mother has been extremely patient and kind to her little boy. And I love her dearly. And I just want to say to every woman in the house, happy Valentine's Day. And to my mother, I love you. I'll see you tomorrow. She's in Baltimore. Thank y'all. Thank you, Madam Speaker.
Clerk will read the caption to a group of privileged resolutions.
Honoring the life and memory of Henry C. Baker Sr. and Ethel Virginia Almeida Ogden Baker. Honoring Georgia court-appointed special advocates and recognizing February 15, 2024 as CASA Day at the state capitol, recognizing Tuesday, February 20th, 2024 as Lupus Advocacy Day at the state capitol, commending Georgia line workers and recognizing April 8th, 2024 as Georgia Line Worker Appreciation Day at the state capitol, recognizing the 10th anniversary of the Georgia 911 Medical Amnesty Law, commending and congratulating Gerald Kemp, commending the Vietnamese American Community of Georgia and recognizing March 5th, 2024 as Vietnamese American Community Day at the state capitol, recognizing the 120th anniversary of the most worshipful Prince Hall Butler Lodge number 226, recognizing and commending Usher Raymond IV, recognizing and commending Reverend Dr. Jamal Harrison Bryant, recognizing February 21st, 2024 as Charter Schools Day at the state capitol, recognizing and commending the Grant Park Conservancy, recognizing and commending Madison Jennings, recognizing and commending the First Senior Center, and for other purposes. That completes the reading of the privileged resolutions.
Is there any objection to adopting the privileged resolutions? The chair hears none. The resolutions are adopted. If you have an announcement, please make your way to the front. We have a few announcements. The chair recognizes Chairman Corbett for an announcement.
Thank you, Madam Speaker. The Rural Caucus will be meeting tomorrow for lunch at the Ag Building, 12 o'clock. Everybody's here for committee meetings. Come join us. Thank you.
Chair recognizes Representative McLean for an announcement.
Thank you, Madam Speaker. I just want to remind all of the Congressional District 7, tomorrow we will have an election for the DOT Board and the State Senate Chambers at 9 a.m. although we're not in, but just wanted to make sure that if you are on Congressional District 7, that we'll meet at 9 a.m. And we have to have a quorum. Thank you, Madam Speaker.
Chair recognizes Chairman Gunter for an announcement.
Thank you, Madam Speaker. The Council of Superior Court Judges on Thursday morning will host a legislative breakfast in room 230 of the Capitol.
Chair recognizes Chairman Darlene Taylor for an announcement.
Thank you, Madam Chair. The House Appropriations Subcommittee on Health will meet upon adjournment in the CLOB 515. Thank you.
Chair recognizes Chairman Dickey for an announcement.
Thank you, Madam Speaker. Tomorrow morning, the House Agriculture and Consumer Affairs will be meeting 6:06, and we're not meeting till 9 o'clock tomorrow, so you can sleep late. Thank you.
Chair recognizes Chairman Collins for an announcement.
Thank you, Madam Speaker. Upon adjournment, the House Public Safety and Homeland Security Committee will meet in room 606 CLOB. We've got a few bills we need to take up. 606 upon adjournment.
Chair recognizes Chairman Werkheiser for an announcement.
Thank you, Madam Speaker. Co-Bill Vass, Industry and Labor will not meet tomorrow on Wednesday, but will meet Thursday, so we'll remind you Thursday. Thank you.
Chair recognizes Chairman Lumsden for an announcement.
The House Insurance Committee, full Insurance Committee, will meet Thursday morning, 8 a.m., CLOB 406. Thank you.
Chair recognizes Representative Earhart for an announcement.
Thank you, Madam Speaker. Upon adjournment, the Regulatory Subcommittee of Regulated Industries will meet in 341 CAP.
The Majority Leader is recognized for a motion.
Thank you, Madam Speaker. I move that this House stand adjourned until 11 a.m. on Thursday, February 15th, 2024.
On the motion of the Majority Leader that this House stand adjourned until 11 a.m. on Thursday, February 15th, all those in favor will say aye. All those opposed will say no. No. The ayes clearly have it, and this House stands adjourned.